So your doctor prescribed prednisone 5 milligrams. Well, you might want to know, what is it used for? What should you look out for? What side effects can you expect? Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here to answer those questions for you. So first of all, what is prednisone anyway? So prednisone is a corticosteroid, anti-inflammatory, and it can be used to help out with conditions ranging from asthma and COPD to autoimmune diseases like rheumatoid arthritis or lupus to allergic reactions or kidney transplants. It can be used for so many different things. And how does 5 milligrams dosage of prednisone compare? So this bottle contains prednisone 20 milligrams. And right now, talking about prednisone 5 milligrams. Prednisone 5 milligrams is considered to be a low dosage, and it is the third most commonly dispensed strength of prednisone, with 10 milligrams being the first most commonly prescribed, 20 milligrams being the second most commonly prescribed, and 5 milligrams being the third most commonly prescribed type of prednisone, coming in at 27.9% of the time. So it's pretty common. Millions of people across America take it every year. And like I said, it is generally considered to be a low dose. 20 milligrams and above is high, and somewhere in between is medium. What would somebody take prednisone 5 milligrams for? How long would somebody take this? Generally, you could take this anywhere from 5 days to 5 months to 5 years. It really depends on what your doctor prescribed it for. This dose is approximately twice as strong as our naturally occurring hormone in our body called cortisol. Cortisol is released by a special system called the HPA axis, your adrenal stress system. And cortisol is what saves us in fight or flight times of famine or war. This is approximately double what our body would naturally be secreting. Our body naturally secretes somewhere around 2.5 milligram equivalent of prednisone per day. So this is basically twice that. And therefore, it's doubling the amount of a hormone in our body, and that causes side effects. And what side effects could you expect at 5 milligrams? Well, the good news is that you're probably going to expect fewer side effects at 5 milligrams than, say, if you were to take prednisone 20 milligrams. Because the higher the dose, the worse the side effects. Which side effects might you experience at 5 milligrams? So I personally had to take prednisone anywhere from 5 all the way up to the equivalent of 220 milligrams of prednisone. And so I've experienced the full range, and these are all the side effects I experienced. But you don't necessarily experience all of those at 5 milligrams. So which ones you could experience include Cushing syndrome. So that's a combination of moon phase and a really strange weight and fat redistribution of your body, where the fat goes to your face, your belly, perhaps the back of your neck. It's a lot less likely at the dose of 5 milligrams, but it is possible. Let me just read you some study information. Weight gain at doses greater than 5 milligrams a day. There was a study, and it had 779 patients with rheumatoid arthritis. And weight gain was more frequent in patients treated with at least 5 milligrams a day of prednisone or equivalent for at least 6 months. So it's not something that happens instantly when you're at 5 milligrams. It's kind of a longer term thing compared with those who had not received any. However, there was a threshold effect such that the rate of weight gain was not increased in those who took less than 5 milligrams a day. So if you are taking a half of this, then you're probably not going to gain much weight. And it was further increased at doses greater than 7.5 milligrams a day. So 21% of people who had 7.5 milligrams gained weight, whereas 15.8%, almost 16, got the moon phase and weight gain at 5 milligrams a day. And another study said, in an analysis of 4 prospective trials of glucocorticoids, that's what prednisone is, in rheumatoid arthritis, the use of 5 to 10 milligrams a day of prednisone or equivalent over 2 years was associated with an increased mean body weight of 4 to 8%. So if you were 100 pounds before you took prednisone, you might be 104 to 108 pounds after a year of taking prednisone 5 milligrams. All right, so that was the first type of side effect, Cushing syndrome with moon phase or weight gain. The second type of side effect that is possible is called cataracts, and that is when your eye lens gets cloudy. Normally, you would expect, oh, that would probably only happen in high doses, but it can happen even, it says, when the prednisone dose was less than 5 milligrams a day. So it's definitely possible, but it's not likely to happen quickly. That's kind of a side effect that happens slowly over time. So if you're on prednisone 5 milligrams for a long time, then cataracts are a possibility. What about heart failure and heart disease? Yes, heart disease is possible when even at 5 milligrams of prednisone, greater than 7.5 milligrams a day, there was an increased frequency of glaucoma, depression, and elevated blood pressure. So around 5 milligrams, you have less risk, but there still is some. It says your risk of heart disease is dose dependent, and your risk of heart disease goes higher the higher the dose of prednisone you're taking. They did a study of 87,000 people in the United Kingdom, and they had inflammatory diseases like rheumatoid arthritis and PMR. And in these people, they reported increased cardiovascular risks associated with long-term prednisone use at doses of less than 5 milligrams a day. So even doses less than 5 milligrams a day had an increased risk of heart disease. And then for heart attacks or myocardial infarctions, the risk increased by 13% for each 5 milligram a day increase in glucocorticoid dose. So your lowest risk at 5 milligrams, and then each 5 milligrams on top of that increased your risk by 13%. What about mood changes or mood swings? They said that the prevalence of depression is greater in patients on more long-standing therapy, even on low to moderate doses. So depression isn't likely after just one dose. It's more of a long-term thing, but it can happen even at low doses. And I keep saying I'm referring to Up to Date Online. This is the most premier medical reference, and they are basing all their information off of scientific studies. All right, so that was the fourth one, was mood swings. The fifth side effect you might expect at 5 milligrams of prednisone includes infection risk. So prednisone is an immunosuppressant. It is turning down your immune system. And the higher the dose, the more immune system suppression there is. But in a large observational study with patients with rheumatoid arthritis, doses as low as 5 milligrams or less of prednisone were associated with a small but clinically significant risk of infection. So you're not going to suddenly drop dead of an infection, but it is increasing your risk compared to people who don't have to take prednisone. Number 6 is memory impairment. So prednisone patients treated with doses of 5 to 40 milligrams a day for at least a year had a partial loss of explicit memory. Older patients were more susceptible to memory impairment with less protected treatment. So basically what's that saying is anywhere between 5 to 40 milligrams, you could have some dementia-like symptoms. They even have something called steroid-induced dementia, which again is more likely the higher the dose, but is possible at 5 milligrams of prednisone. But back to the good news is that there are also some data that have suggested that very low doses of glucocorticoids, which is prednisone less than 5 milligrams a day, are associated with fewer adverse effects. So 5 milligrams is a lot better than 10 milligrams, which is even better than 20 milligrams as far as decreasing your risk for side effects. But there is no safe dose of prednisone. One pill is enough to cause side effects. One 5 milligram pill can cause side effects. There's no perfectly safe amount of prednisone to take. But the important thing to talk about here is that do the benefits outweigh the risks for you? And that's really the only conversation you can have with your doctor because they understand what your risks are. But essentially, you need to know, how much is the prednisone actually helping you? Is it giving you the ability to get out of bed? Is it giving you the ability to play with your family? Are you able to actually go back to work because of prednisone? If so, that's pretty awesome compared to these side effects, which aren't significant at 5 milligrams, but are possible. So it's really a decision you're going to have to make with your doctor, whether it's worth it for you to take prednisone 5 milligrams. And so if you're wondering, is prednisone 5 milligrams very strong? No, it's not very strong. It's fairly low dose. And finally, how long can you stay on 5 milligrams of prednisone? Some people, like I said, could start with just 5 days of 5 milligrams of prednisone, but some people are stuck on 5 milligrams of prednisone for life, whether it's for rheumatoid arthritis or a kidney transplant or some other long-term condition. There are people who have no other choice than to just continue taking prednisone long-term. But the general recommendation when it comes to prednisone is to be on the lowest effective dose for the shortest period of time possible. You want to expose ourselves to the least number of milligrams of prednisone that we possibly can. So if that's something you're wondering about and you're thinking, how can I otherwise decrease my risk for side effects? What else can I personally do that if I have to take prednisone? Is there anything I can do? And yes, I created a prednisone checklist that includes my top tips for people on prednisone, such as things that you can do to prevent ongoing side effects, things you can do to deal with the side effects you currently have. So you can download that by clicking the link below. Signing off is Dr. Megan, your prednisone pharmacist.